So what happens when the man comes in and has the screening, which, as you made clear, is pretty rapid, pretty quick, and then goes back, you're like, okay, there's something suspicious, and they come back and another battery of tests. What happens then, both in terms of the extra testing and what the man will do for treatment?
Basically, if we find something abnormal, I'll discuss it with the patient because, before we go on, you're going to be somewhat invasive and there's some discomfort involved. And, there's also a big controversy now about, should you do biopsies, doing too many biopsies, over-treating patients with prostate cancer because prostate cancer in many cases can be observed. It's not going to kill a man necessarily. So because of all that, those controversies, I'll have a frank discussion with the man, the pros and cons of the further diagnostic procedures. Well, the diagnostic procedure that is the gold standard is doing a prostate biopsy, basically taking tissue samples of the prostate. There is some discomfort involved. It's about a 5-6 minute procedure, and then but that way we can definitively diagnose prostate cancer.
You mentioned there were no symptoms, but might there be a lump or anything like that a woman might find in her breast? So you wouldn't feel anything
just
at all?
Just on a regular, for a layperson, you're not really going to feel anything on the prostate, but the doctor will find like a lump on the prostate or a hard area on the prostate, and that would be a red light signal that something is wrong, and that will prompt us to probably recommend a biopsy.
Okay. And then, because I was wondering if maybe, something rubs inside and you would feel,
No,
irritated
you
or something.
You don't. What you might notice, for example, is, slowing of the stream, not emptying completely, having to urinate at night. But those are symptoms of an enlarged prostate, so not necessarily of prostate cancer. However, prostate cancer can enlarge the prostate and cause those symptoms. But on the other hand, an enlarged prostate does not mean that you have prostate cancer. So yes, you can have some symptoms that prompt you to investigate further, but they are non-specific symptoms. Especially younger men often have no symptoms at all.
If you do experience something like that, don't let it go.
No, don't let it go. Always have get it checked out. And you don't necessarily have to immediately go to see a urologist. Even a primary care physician is usually well-trained enough to do a screening test, check things out. Sometimes if he feels that everything is okay, then he'll start the patient on some medication to relieve the symptoms. However, if the primary care physicians feel something abnormal, they will usually refer the patient on to a urologist. Now, or sometimes patients just come straight to a urologist.
Now, am I correct in saying that if prostate cancer is identified quickly enough or in an early enough stage, it's actually relatively easy to get through and recover?
Exactly. The earlier you find the prostate cancer, the smaller the prostate cancer, the easier it is to get rid of. As a matter of fact, you probably have, with a very early stage prostate cancer, you have almost 100% cure rate. And there are now, and one of the things that men also scares them about the prostate exam and everything is that initially, and especially a few decades ago, if you had prostate cancer, then the only treatment really was this huge operation with possible blood loss, hospital stay, and what speaks especially to the younger public, impotence, loss of erectile function, and incontinence or loss of bladder function.
All as a result of the surgery.
As a result of the surgery. So a lot of men, were impotent and incontinent after the surgery. Now with refinements, that has been reduced significantly, although still present. Now there are also, especially for very early prostate cancers or just early prostate cancers, there are now treatments available that are minimally invasive and non-invasive and actually preserve potency and incontinence.
Such as?
There are several treatments available. I'm involved in those. The one is called HIFU, High Intensity Focused Ultrasound. It is a procedure where we actually use ultrasound energy in order to destroy the prostate tissue. And we can do that because you don't have, and we can do that through the rectum without making any incision. So, and it is an outpatient procedure. It's a one-time procedure. Patient goes home the same day, and there's minimal pain and no blood loss. There's no radiation involved with this treatment, and it is very effective. And especially, as I said, the small prostate cancer, any treatment modalities such as the surgery, the radiation, even HIFU and freezing the prostate are going to be very effective in getting rid of the cancer permanently. But the newer modalities such as HIFU and focal cryoablation have much higher potency rates and much higher continence rates. So there is not as much effect on the quality of life as with the old-fashioned treatments.
I think that would be a very good motivation for men to go ahead and get screened, because if you can get it identified early, and that sounds certainly not great to have to go through, but just not that bad.
Exactly. I think that nowadays, the earlier you find it, the easier it is to treat, and we have the modalities available now in order to get rid of it without affecting your life as much.
Well, what happens with late-stage cancer?
With late-stage cancer, it is very difficult to cure it. There are no ways that we can suppress it and slow it down, and sometimes slow it down to for such a time that the patient will survive it, so that he will die of something else and not necessarily prostate cancer. But it is basically medical treatment, and we can at the very least prolong life and sometimes put the cancer in such a stasis that it will not bother you anymore.
And how do you slow it down?
With medications, most medications nowadays are injectable medications it's not hormones. In the old times, they would give men female hormones because what they figured out early on is that the male hormone testosterone, it can stimulate the cancer. By taking away the testosterone, you slow down the cancer. The cancer has no stimulus to grow, or less of a stimulus to grow. Now, it is good to realize that testosterone doesn't cause prostate cancer, but if you have prostate cancer, it will advance it.
Oh.
Now, by taking the testosterone out of the picture, you slow down the cancer and sometimes bring it to a complete halt, that it doesn't go any further. You don't get rid of the cancer, but you slow it down significantly. What they did is, in the past, they would give men female hormones with all the side effects of female hormones and had that same effect of blocking the testosterone. Nowadays, there are medications available that will block the testosterone without the necessarily side effects of female hormones. So we're just blocking the male hormone testosterone. And the medications are getting more and more advanced. We started with monthly injectables, and sometimes you had to supplement that with pills. Longer-term injectables that last 6 months to a year. And there are multiple medications on the market that do that now for advanced disease.
So I know there is always a focus on research and trying to prevent people from any kind of cancer. What is the latest research, the latest findings?
There is multiple research going on. One of the problems is that we don't really know what causes prostate cancer except for age. If somebody ask me what causes prostate cancer, well, age. With advanced age, your chances of prostate cancer increase significantly. There is some evidence that the diet has something to do with it, the fat content in the diet. We see, for example, that Asian people have a very low incidence of prostate cancer, and less so than in the United States. However, when you transfer that person to the United States, you see that his risk for prostate cancer becomes the same as anybody else in the general